In another Medmastery lesson, we discussed the physiological differences between the pediatric and adult hearts, as well as the cardiopulmonary changes that occur in the pediatric patient. Now let's discuss the differences in preparing to perform an ECG on a child, as the process of collecting the ECG is also slightly different. We are familiar with the conventional ECG used for adults, which consists of 6 limb leads, 1, 2, 3, AVR, AVL, and AVF, and 6 precordial leads, V1 through V6, placed on the chest for a total of 12 leads, captured by 10 electrodes. But the standard approach for obtaining an ECG in a pediatric patient less than 18 years is to use 15 leads captured by placing an additional 3 electrodes on the chest. The 3 additional electrodes correspond to 3 leads, V3R, V4R, and V7. V3R and V4R are right-sided precordial leads that are placed on the right side of the chest, mirroring the positions of their counterpart leads, V3 and V4, which are located on the left side. And V7 is placed in the 5th intercostal space along the left posterior axillary line, just to the left and behind V6. These additional leads are meant to provide ECG information from the right side of the chest. But why would we need ECG information on the right side of the chest when the heart is located on the left side? Well, because the heart isn't always on the left side, known as levocardia. In some patients, the heart is located on the right side of the chest, or dextrocardia. Congenital conditions like this are often identified during childhood, where establishing a baseline can be helpful for future assessments and management. Right-sided leads ensure a comprehensive assessment of the heart's electrical activity when it's positioned atypically. Though dextrocardia is uncommon, occurring in about 1 in every 12,000 patients, patients with congenital heart disease are much more likely to have dextrocardia. Placing leads on the right side of the heart makes it much easier to identify this variant on a conventional ECG. The third additional ECG lead for pediatric patients is V7, recorded by an electrode placed on the left side. V7 provides information on the far left side of the heart, specifically the electrical activity on the lateral wall of the left ventricle, helping to identify electrical abnormalities that standard leads might miss. This is particularly valuable in pediatric patients with unique or developing cardiac physiology, including those with congenital heart defects, suspected arrhythmias, or conditions such as right ventricular hypertrophy or ischemia. These additional leads provide a more comprehensive view, helping to detect subtle abnormalities in the posterior or lateral walls that might otherwise be overlooked. You may be wondering when it is appropriate to use a 15-lead ECG. As a pediatric electrophysiologist, I would say on every child requiring an ECG, as we cannot assume a patient will have normal left-sided heart positioning. Acquiring a 15-lead ECG requires minimal additional time and can provide useful information in detecting right ventricular strain, congenital heart defects, or subtle ischemic changes in the pediatric setting.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Medmastery can help you become a great clinician, make sure to watch the About Medmastery video. So thanks for watching, and I hope to see you again soon.